see the changes because of the relationship between the kidney and the psoas and a lot of the anterior structures that sit on the psoas. And the psoas will shut down or become a little weakened because it doesn't want to fire and contract and pull on those structures. So I'm going to go ahead and have you lie on your back. Please. And so what I do is I'll have them look at, I truly have patients do this first. I'll say keep your leg straight, turn your foot out a little, and just lift it up to here and notice if how heavy your leg feels or not, and come back down. And then the other side. And I look for quality. How do they stabilize in their pelvis and back down? Did one leg feel heavier than the other? Not really. So if there were one leg, they might notice one leg was a lot harder to lift than the other. So go ahead and lift this leg up again. And she's more stable when she lifts her right leg. And then I'll apply pressure and say, hold, don't let me move you. And she does a pretty darn good job. And come back down. And then this side, go ahead and lift. And she drops a little more on that side. Hold, don't let me move you. And that side's a little harder for her to do. She's strained a little more with it. But she's really pretty good. If I were interested, and this side is more interesting than this one to me, because she did a pretty good job of stabilizing, did this leg feel easier or harder than this leg? Felt harder. Okay, so I try not to set them up to go, yeah, whatever you say. Give them choices, right? So now I will come in and I'll look at where that psoas runs, and I'll just support. Now I could, just like with the upper body, I could go, well, maybe it's something more over here, or more over here, or more into the pelvis. But let's just come sort of over that. Kidneys are under the top of my fingers, sigmoid's under that hand, her left ovary is there, the edge of her uterus. There's a lot of structures that I'm sort of supporting. And am I pushing hard? Okay. So I'm light pressure. I'm not like stabilizing the pelvis. It's just putting a different input into the nervous system and giving her a little bit of stability. Go ahead and lift that leg up again. Did that feel lighter this time? Or did it feel different? Yeah. How about now? So hold. So how different is that than if I let go and do it again, and I usually try to, and you can feel, and now try to hold, and she can't. Her system starts to buckle and ratchet. So that's the psoas test, and I'm looking at quality of movement, how do they stabilize? If I put a little pressure or support, does it change their response? Does the leg feel lighter? Do they have better stability? Do they feel less pain, or whatever else? Thank you.